Thank you for joining us today. Allison and I will be talking a bit about our research topic, anthocyanins and colon cancer. I will begin by giving you a quick overview of what we will cover throughout this presentation. First, I will introduce anthocyanins and talk about some of the food sources, metabolism, and absorption. I will also discuss colon cancer and its prevalence in the U.S. Next, Allison will discuss some mechanisms of action of anthocyanins and give us a summary of our literature review findings and conclusions we've made based off the evidence. So what are anthocyanins? Anthocyanins are a subgroup of flavonoids, which are a type of phytochemical. Anthocyanins are the most abundant flavonoid found in a wide variety of fruits and vegetables, such as berries, grapes, apples, eggplants, corn, and other plant sources, usually blue, purple, or red in color. The basic chemical structure includes a flavulum cation, which links a hydroxyl and a methoxyl group and one or more sugars. The color of anthocyanins depends on their pH, chemical structure, and glycosyl group, containing either glucose, galactose, ramenose, xylose, or arabinose, which are attached to the aglycan nucleus. There are 6 different types of anthocyanins that depend on the positioning of the hydroxyl and methyl groups. These groups include cyanidin, delphinidin, pilonidin, pelargonidin, malvidin, petunidin, and thionidin. Anthocyanins possess antioxidant properties that may reduce inflammation and oxidative stress, therefore play a protective role against chronic diseases such as cancer. Metabolism and absorption. So the extent of anthocyanin absorption is dependent on the type and chemical structure. Anthocyanins begin to absorb in the mouth, where they are hydrolyzed by enzymatic deglycosylation. In the stomach, they remain chemically stable due to their low pH and are absorbed through active transport. In the stomach, they are absorbed about 19 to 35% by gastric juices. Then in the small intestine, anthocyanins are further absorbed through active transport. In the large intestine, further enzymatic deglycosylation and degradation takes place. Several studies have determined that the highest anthocyanin absorption takes place in the jejunum. However, overall, anthocyanins are first broken down to anthocyanidin aglycan through deglycosylation and are then degraded to phenolic acid and aldehyde by the intestinal microflora. So in colon cancer, malignant cells develop in the tissues of the colon. It's the second leading cause of cancer-related deaths in the U.S., and it's the third most common cancer among both men and women in the U.S. There are several risk factors associated with colon cancer, which include overweight, obesity, physical inactivity, diets high in red meat, smoking and alcohol use, as well as age, being over 50, family history, ethnic background, and type 2 diabetes. Researchers and health professionals have been exploring the effects of diet modification on prevention and treatment of colon cancer, such as increasing daily fruits and vegetable consumption, which are high in antioxidants and anthocyanins.
Through researching various articles, we found a few important mechanisms of action related to cancer that anthocyanins possess. The first is the role of anthocyanin in inducing phase 2 antioxidant and detoxifying enzymes, which is beneficial in reducing oxidative stress, which is a major cancer preventative property. Secondly, anthocyanins have shown anti-proliferative activity. One study showed that when tested on normal cells and cancer cells, there were significant anti-proliferative activity on cancer cells and no significant effect on normal cells. The induction of differentiation and apoptosis also is a mechanism of action that anthocyanins have. Apoptosis is normal in regulation of cells so that there is normal growth. However, when cancer cells are present, apoptosis is not present, so anthocyanins have proven to aid in the induction of this important mechanism. Anthocyanins have been attributed to their anti-inflammatory, anti-mutagenic, and anti-carcinogenic activity by acting as antioxidants, detoxifying agents, and inhibitors of cancer cell growth in the body. And lastly, they promote anti-angiogenesis factors, meaning anthocyanins play a major role in suppressing the forming of new blood cells in tumors that are growing in cancer. So, should anthocyanin intake be included as a supplemental treatment method for oncology patients with colon cancer? Our answer is yes. Throughout our research, we haven't found any negative effects that could possibly harm someone who used this kind of treatment. There is plenty of research available that shows all the beneficial mechanisms of action that anthocyanins have, so we think that incorporating this as a supplement in treatment would be helpful and beneficial for patients with colon cancer. So what does the research say? We've told you about what anthocyanins are, the mechanisms of action, and overall what we think about anthocyanins. But here is a little more information on what we found. The research we found shows that anthocyanins should start being used in both prevention and colon cancer treatment because of all these factors listed. And lastly, we're going to talk about practice guidelines. The current practice guidelines have no DRIs for anthocyanins. However, anthocyanins have been proven to be effective in treatment and prevention of cancer, and more specifically colon cancer. Of course, there needs to be more research to make full strides of causing dietary guidelines for anthocyanins, but the research available is a great building block. In future clinical settings, developing recommendations for anthocyanins as guidelines for medical nutrition therapy could promote a shift towards increased use of alternative and complementary medicine over traditional Western medicine. Thank you for watching our presentation on anthocyanins, and we really hope that you learned a lot more about the effects on treatment and prevention. Have a great break.